Hello, beautiful people. Today I want to introduce to you guys a topic that I think all of you should know and understand to some extent, but especially those of you who have a strong family history of heart disease, or if you yourself have any sort of heart disease, such as high cholesterol, high blood pressure, atrial fibrillation, and so on. This is a process that drives all of these different types of heart disease to varying degrees. And the more you have of it, the worse the outcomes. It's also something that you can test for. So in today's discussion, I'm going to be going over what the process is and how to test for it, what to ask for so you can monitor your efforts. Now, today I am talking about oxidative stress. Now, that may sound like a very complicated topic, but I'm going to break it down for you in simple terms so that you can understand why this is so important to be aware of, how you can track it, and therefore how you can work towards lowering that inside of the body so that you can live a longer and happier, healthier life. But yes, first I should probably define for you what oxidative stress is. Oxidative stress is defined as too many reactive oxygen species, aka free radicals, with not enough antioxidants to neutralize those things. So free radicals are essentially unstable molecules that can go around interacting with other proteins, DNA, and a lot of different things inside the body and ultimately lead to a lot of destruction. So under normal circumstances, we do produce antioxidants to neutralize these things. These things can be made in natural metabolism as a product of metabolism. They're made when we're exposed to too many toxins, pollutions, a lot of processed foods. There's a lot of things that will drive those free radicals up. And theoretically, we should have enough antioxidants in our diet to really help combat that. We also produce a lot of these antioxidants naturally, but in modern day times, this is not being balanced out. And that's something that I think we all really need to understand is that, yes, ultimately we are trying to counteract a lot of this oxidative stress that we're exposed to with a good diet. And yes, that is the foundations. But there's a lot more things causing these reactive oxygen species inside the body than there ever used to be. So our natural defenses and what we can possibly get through diet might not be enough. And so that's where consulting someone to really work on lowering your oxidative stress can be foundational to good cardiovascular health. But there are also ways to test it. So we're going to get to that. First, I really want to highlight to you why oxidative stress is leading to so much cardiovascular damage and really emphasize for you why you should really care. But let's briefly just introduce myself and then we can dive into the topic. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada. And now let's get into oxidative stress. So before I go over the process that's leading to all this damage, I want to just briefly highlight to you how many different places this is coming from. So oxidative stress can be a product, as I said, of just natural metabolism. If you start to have blood sugar problems, that'll drive oxidative stress up. So that could be prediabetes or, of course, full-on diabetes. We can get it from a lot of chronic infections. So people who have Lyme disease, mold issues, chronic Epstein-Barr will have a ton of oxidative stress because those infections produce a lot of inflammation. If you have one of these inflammatory conditions like rheumatoid arthritis, a lot of these autoimmune conditions, that's for sure going to drive oxidative stress up. Just the simple inflammation that comes on with having too much weight in the body can do it. Having gut problems like microbiome issues or a leaky gut that produces a lot of inflammation that can get into your bloodstream can do it. And just simple aging and the accumulation of all these different environmental toxins that we are exposed to will drive our oxidative stress up. So we have a ton of different reasons we have this out of control free radical production that's not being compensated with our natural antioxidant production or what we're getting in through the diet. So why is oxidative stress so bad for your cardiovascular system though? And that's an important question to ask. The first and most obvious place things are going wrong is that these free radicals will damage our artery lining, or what we can call our endothelial cells, which are essentially just the cells that make that lining up. When there's damage, literal structural damage to that lining, that can act as an entry point for cholesterol to get in there and start forming plaque. And we're mostly talking about LDL cholesterol, which is our bad cholesterol. As some of you may already know, that isn't the best marker for this bad cholesterol, but nonetheless, we do care if it starts to get into the lining because that's ultimately steps 1 and 2 of developing plaque. And of course, the more that's happening, the more plaque you develop, the more clogged your arteries will get, and then that can obviously drive up things like blood pressure. And so the free radicals can have a literal damaging effect to the lining, and that is leading to a lot of heart disease. Now, another thing this excessive oxidative stress can do is it can oxidize your LDL cholesterol directly. Now, bear with me for a second because I'm going to get a little technical to help you understand why that matters. LDL cholesterol isn't inherently bad. There's obviously a reason we've produced it in the body, and it serves an important function. What it essentially will do is it'll drop off cholesterol to different parts of your body for use. We use cholesterol to make things like our hormones, so estrogen and progesterone, things like that. It can be useful for making other compounds like vitamin D inside the body. We need cholesterol to be dropped off to tissue for use. When your LDL cholesterol becomes oxidized, it becomes dysfunctional. So it no longer efficiently will bind the receptors on your cells to deliver that cholesterol to where it needs to go. But what it will do is it'll interact with the immune cells inside that lining, and then the immune cells will get flagged to try and dispose of it, to try and eat it up, because essentially that LDL cholesterol that has been oxidized is no longer serving the function the body wants it to serve. So your immune cells will try and dispose of it. So when it gets into the lining, your immune cells will be there trying to gobble it up. When this happens in small amounts, that's a normal process. That's how we get rid of it. When it happens in high amounts, we start to have a lot of cholesterol getting in there. Our immune cells really have to work very hard to gobble that up, and you start to form what we call foam cells, which is the earliest sign of plaque. That's essentially what the plaque is made up of. All this cholesterol getting gobbled up by these immune cells and all this dysfunction happening at the same time. Because what oxidized LDL will also do is it'll create dysfunction in that area, so inside the lining. One way it does this is it reduces the amount of nitric oxide that your lining can produce. This is important because nitric oxide is what helps relax the blood vessels and open them up. So if we have less of that being produced, theoretically, you won't have as relaxed of blood vessels, therefore your blood pressure goes higher and higher. So this is just one example of how even just the presence of this oxidized LDL creates dysfunction within the area, which is going to perpetuate cardiovascular disease like hypertension, but also further perpetuate that by building this plaque up, making it bigger, bigger, and bigger, which of course is going to narrow and narrow and narrow those arteries and vessels further. So this is another way that the oxidation is creating a lot of cardiovascular disease. And now the last thing is arguably the most important part of this to understand. And it's not that the oxidation, when out of control, leads to more plaque formation. That's bad. It also leads to more LDL that becomes oxidized. That's also bad. But cherry on top of all of it, what it also does is it creates a plaque that is very unstable. The more oxidative stress you have, the more unstable that plaque is. Now, this is very, very important to understand because what that means is that plaque is more likely to rupture or pop. When it pops, it releases the inner contents of that plaque, which is full of all of these inflammatory compounds. And once that hits your bloodstream, because it's popped open and spilled into the bloodstream, that forms a clot. And now most heart attacks and strokes are because of that clot. It is a common misconception that the size of the plaque matters. That matters in a blood flow perspective for sure, but if we're talking about what gives you a heart attack and what gives you a stroke, which are kind of the main things we're trying to prevent when we're lowering blood pressure, lowering cholesterol, trying to help your cardiovascular system, we're trying to prevent these life-threatening events like heart attack and stroke. And more often than not, it's because of an unstable plaque that has ruptured. It's not because of a plaque that's just grown and grown and grown and cut off blood supply, because that's what a heart attack is. A heart attack is when the blood supply to a part of your heart has been cut off, which will of course lead to no more oxygen being delivered, no more nutrients being delivered, and that tissue will start to die. The same thing happens in your brain. The blood supply gets cut off and then part of that brain tissue starts to die. And so most people would assume it's just because a plaque got bigger and bigger and bigger and eventually closed that blood supply off. That's rarely the case. More often it's a clot that got formed because a plaque ruptured, formed this big clot, and that clot got lodged somewhere. So this is another reason why we very much care about oxidative stress, because it makes that plaque more unstable, aka more likely to rupture. Okay, so that's probably all you need to know to really understand that oxidative stress is a very big deal. Now I want to talk to you about some of the tests that can help you understand how much oxidative stress you have within your cardiovascular system so that you can monitor this. If it's really high, get on things right away, and then keep remeasuring it to see if your efforts are paying off. Now, these tests are super well backed by a bunch of research, but they're rarely done. So please pay attention to what your doctor's running and make sure that if these aren't being ran, they do eventually get ran for you, because it's very helpful. It's got a ton of research to support them, but for whatever reason, they haven't made their way into common practice quite yet. So I very, very, very rarely see these in the blood work that my patients are coming in already having done. This is not routine, so please pay attention and ask for these tests. So as we get into the testing, just note that this isn't the entirety of tests that could be done, but I wanted to choose some of the ones that you're more likely to get and that have probably the most research behind them, because some of these things that you look up and find in the research are really only done in a lab, or they're incredibly hard to get a hold of. And don't get me wrong, some of these aren't the easiest to get a hold of either, because again, not every doctor is running them or aware of them, but at least they're a little bit more likely and the odds. So I'm going to start by one that's probably the easiest to get a hold of, but it's the least specific to the cardiovascular system. And that's something called C-reactive protein, aka CRP, or you'll sometimes see it as HSCRP, which just stands for high sensitivity CRP. But either way, I'm just going to use CRP for short. And so this is a protein produced by the liver in response to inflammation. So it's usually in response to big things like infections, autoimmune diseases, or a more destructive disease process. So this is associated with big inflammation. You won't really see this marker go out of range when you have low-grade inflammation. Say you just eat too much inflammatory foods in the diet, it's not going to spike your CRP. But if something bigger is happening, like an infection, like an autoimmune disease, then you start to see CRP go up. And that's a sign that you are very, very inflamed in a more global sense. And so this one is more or less a screener, because it's not super specific to one area of the body or one process inside the body, but nonetheless still a very important marker to understand, to have ran. And if it is too high, you very much want to see that come down, because that's a reflection that your overall inflammation is coming down, which is important to know, right? Because we're doing a lot of these things to clean up our diet, our lifestyle, the amount of toxins we're exposed to, or maybe even taking anti-inflammatories, antioxidants, things like that. And we want to make sure they're actually having an effect. So CRP is a really good one, but it's also very broad. So the next ones I want to talk about are a little bit more specific to inflammation of the cardiovascular system and more specific to plaque formation. And those are things like oxidized LDL, which is something we've already talked about, but you can measure that directly. Something like MPO, PLA2, and homocysteine. So why don't we start by talking about PLA2, because this one is very interesting and very important to understand. So PLA2 stands for phospholipase A2, which is an enzyme that will interact with fats that make up your cell membrane and things like that, and produce some inflammatory compounds, namely arachidonic acid, which is a very well-known inflammatory compound. So more of this enzyme means more arachidonic acid, which means more inflammation. And all of this is typically happening inside the plaque, inside the artery walls. And so what it's going to do is make that area a lot more inflamed, and inflammation equals less stability. Inflammation, more unstable plaque, more likely to rupture, more likely to form clots, and all of that fun stuff. So having an idea of how much this enzyme activity is going on, that's going to be super important. And it's very well linked to more advanced cardiovascular disease. So when you have higher amounts of it, you see more plaque formation, more heart disease, more heart attack, more stroke. This has been well documented in the research, so a very important marker to understand. The next one I want to talk about is very similar, but of course doing it in a slightly different way, and that is a marker called MPO, which stands for myeloperoxidase. So this one's also associated with high inflammation inside the arteries and more plaque formation and all of that. But this one is happening through a slightly different mechanism. So MPO is something that your immune cells will release to try and fight off things like infections. So it tends to have a higher correlation with infectious processes like chronic infections, which not everyone is aware they have some of these things like Lyme disease, mold illness, stuff like that. But even lower grade infectious things like microbiome issues and stuff like that, they can all drive an MPO up. So usually if that marker is going elevated, that's kind of some of the thought process I have, is let's further investigate some of these infectious causes. Although it's not the only thing, it is highly correlated with those things because it's what your immune system uses to defend us against infections. We always do things like this. We always release inflammatory compounds to try and beat up those viruses and bacteria. That is a normal process, but it's just, again, when they're having to do it too often, say there's a chronic infection process going on, it's not just a cold or a flu or something brief, then you can see this go elevated more chronically. And it's interesting because, yes, of course, very related to things like heart attack and stroke, which is why I'm talking about it today, but it's also related with a few other things. So I'm just going to briefly read these so I don't get them wrong. But elevated MPO has been linked to, yes, cardiovascular disease for sure, neurodegenerative disease like Alzheimer's, which is a huge deal. We see it with more advanced lung disease, arthritis, cancers, kidney disease. So our whole body is connected. Of course, if a lot of these things are inflaming our cardiovascular system, they're also leading to other issues in the body because oxidative stress is creating free radicals. And free radicals don't just target your cardiovascular system. They're unstable molecules that interact with anywhere in the body. So again, when we start to see these things go up, it's very helpful for preventing cardiovascular disease and a slew of other diseases. So again, why I say everyone should understand these things, not just those of you with a strong history of family heart disease. Okay, so the last two are a little easier to get a hold of Some of you may have already had them ran, but we'll talk about them anyways. And the first one is something called homocysteine, which is an amino acid that's usually just intended to be part of a larger pathway. So we call that like an intermediate product, which really means it's just supposed to be there temporarily as part of a pathway to produce something else. But what happens is if you have certain nutritional deficiencies like B12, B9, or B6, or if you have methylation issues, which is something I've talked about on this channel before, you can start to see a backlog of that reaction and homocysteine levels start to rise. And this is a big problem because the homocysteine itself can create a lot of this oxidative damage that we've been talking about. And so again, we will see it go higher and higher, and that leads to more advanced cardiovascular disease. But this one's very interesting because it's very linked to nutritional deficiencies. And that's because it's more or less just a backlog of something that can't move forward until you have enough B vitamins, for example. And so this is why having good nutrition is so important, is because all of these minerals and B vitamins and things like that are all used to carry reactions forward. These processes require a lot of these nutrients to function. And so when you're deficient in these nutrients, then you start to see backlogs, and this can lead to a lot of inflammation and a lot of homocysteine. So that one's super interesting. And the last but not least is oxidized LDL. As I mentioned in the earlier part of this video, oxidized LDL is when you've had a lot of oxidative stress. It interacts with the LDL and creates this dysfunctional LDL particle that will increase plaque formation. As I mentioned earlier in the video, it leads to more plaque, it creates dysfunction, it drives blood pressure up, and all of these things. So again, it's another thing that you can measure and track. When you go to do all the things to help heal your cardiovascular system, hopefully you start to see those numbers come down, and then you can be reassured that your efforts are paying off. Because the horrible thing about cardiovascular disease is it's often not something you necessarily feel. So it's really hard to track based on symptoms. Hey, how are you feeling today? On how well these things are working. It's called the silent killer for a reason. That's because a lot of these things are going on beneath the surface without you necessarily feeling your arteries clogging. That's not necessarily something you'll even remotely feel going on until it's really far gone. And so these markers are very important to get in early life. If this process is happening early on in your 20s, in your 30s, in your 40s, it's going to accelerate all of the damage. But the good news is cardiovascular disease is 90% preventable. So if you can get a hold of these tests and you can get proactive about your health, which I would say you could do at any time. Certainly prevention is great, but even if you've already had a heart attack or you've already been told you have all this cardiovascular disease going on, it's never too late. But certainly for those of you who don't think this might be an issue, don't think that, because you can do a lot to prevent this from ever becoming an issue if you have the knowledge and if you have the right testing to track these things. So I hope that today's episode was helpful. If you guys have any questions about today's content, please comment that below, and I look forward to seeing you guys at the next video. Thank you.